All right, we have 86 participants with us so far. I welcome everybody. Good afternoon and happy Friday. My name is Mark Melanson and I'm the Executive Director of the California Community Living Network. A few logistics. This meeting will be recorded and we'll be posting that to our website for future viewing. We do have ASL interpreters and would ask that folks be patient with us as we move through our presentations because we'll be shifting from PowerPoints to speakers, that we make sure that we're featuring the ASL interpreters. We have asked all panelists to keep their cameras off so that it's easier to feature those ASL interpreters. We're really excited to be with you all today for the CCLN monthly member meetup on PAVE service outcomes. Because we are announcing some pretty big news today, we have opened this meeting up to everyone, not just our members. So a little bit of history. This work really began to take shape back in 2016 with HCBS compliance and with the final rule. It continued in January 19th. With the CCLN's release of a competitive wage study, which examined the wages of direct support professionals. In October of 2019, CCLN hired an executive director and began our work on a grant from the State Council on Developmental Disabilities. That was titled PAVE, and that stands for Person-Centered Vision, Advocacy, and Education. We assembled an amazing group of thought leaders and we called it the PAVE Advisory Group. The PAVE Advisory Group was comprised of people served, families, providers, and other stakeholders. This was the body that advised us as we began our journey of the Service Outcome Project. We completed that work on the grant in December of 2020. That brings us to today. Today we will feature CCLN's latest accomplishment and announce CCLN's very first sponsored bill. Upon completion of our work on Developmental Disability Service Outcomes Project, we were excited to be taking the next steps to advance a bill that will create and fund an administrative pilot to implement the work of PAVE. This bill is proposing a pilot project on defining, measuring, and using service outcomes for the developmental disability service system. It's inspired by CCLN's work on competitive wages and the PAVE Service Outcome Project. We have an all-star lineup of speakers for you today. Who knew that when we began this work on PAVE that it would take us nationally and internationally? Today, you will hear from many of the consultants we engaged with on the project and details about the proposed pilot project. I want to start with the author of our bill, and I'm going to share a photo. Assemblymember Speaker Pro Tem Kevin Mullen has been a champion for our community. Back in 2018, he provided a recording in support of CCLN for our very first legislative breakfast at our annual leadership conference. He also received that year the CCLN Key Person Award. So that's a photo of him being presented with the Key Person Award presented by Jackie from STEP, as well as some of her employees and the people that she serves. We have the key because the key is the key to your own apartment and is a very powerful symbol. So that's why it is the Key Person Award. So I'm going to stop sharing that. Assemblymember Mullen sent us a recording so that he could do our opening remarks. So I am going to hopefully play that for you now so that we can hear from the author of our bill.
Good afternoon, everyone. Assemblymember Kevin Mullen here. I'd like to thank you all for inviting me to be a part of the California Community Living Network's monthly meeting, and I'm sorry I can't be with you live today. As an active member of the Select Committee on Intellectual and Developmental Disabilities, I'm excited to author a bill this year, AB 813, that I believe will have a positive effect on the IDD community. Our select committee has heard too often that our state continues to underfund the IDD service system exhibited by the rate study and other reports. We know that a major contributing factor to this is simply lack of data. That's why when I was approached to author a bill that would provide the state with data and quality metrics to better evaluate how services are being delivered to the developmentally disabled community, I agreed. Through the implementation of this pilot, I believe California will be taking an important step toward providing quality services in a manner that will allow individuals with developmental disabilities to pursue their chosen ways of life in the community. I appreciate CCLN's support of the bill, and I look forward to partnering with you all this year. Thank you.
Fantastic. Thank you, Assemblymember Mullen. You know, we have been working with one of Assemblymember Mullen's staff for many years and many hours of meetings. Back in January or February of 2020, Elena Ortiz, the legislative aide that is with Assemblymember Speaker Pro Tem Kevin Mullen's office, worked with us on a community stakeholder budget request. That was a $2 million request for to pilot PAVE. But then the pandemic hit and put everything that we were working on hold. So I would like to acknowledge really the hours and hours and hours of meetings that we've had with Elena, her work on really understanding the concepts of our crazy idea, and just let her introduce herself and just really appreciate the collaboration that we've had over the past 2 years. Elena?
Hi, Mark. Thank you for that. Hi, everyone. I just want to introduce myself. My name is Elena Ortiz, and I'm a legislative aide in Assemblyman Mullen's office. Thank you so much for having me today. I'm really excited to be staffing Assemblymember Mullen on AB 813 this year, and look forward to partnering with you all to ensure this critical piece of legislation gets passed this year. So thanks again.
Thanks so much, Elena, and truly appreciate so much of the time that you've dedicated to us. So we look forward to working with you as well. So with that, because we now have a bill, CCLN has engaged with two amazing lobbyists who are here with us today. And I would love for them to quickly introduce themselves. You know, we're excited to be at a point where CCLN has engaged with lobbyists to help us advance that bill. And I'd like to take the opportunity to introduce Kathleen Mossberg and Erin Levi, who are with us today briefly because they're very busy and need to get on to advancing our bill and other work that they're doing. But just want to appreciate and introduce our two amazing lobbyists. Erin and Kathleen.
Hi, yes, hi everyone. Thanks for having us today. And very excited to be part of the team. Appreciate all that's been said already. Per Mark's point, we will be brief, but just wanted to give a general sense of kind of who we are. Erin and I both have been lobbying in Sacramento for decades. And again, very excited to be a part of this team. I think you can look forward to hearing from us at key points in the bill and asking for your support and asking for you to send in letters and perhaps make calls, who knows. Wanted to sort of outline just sort of briefly the oddity of Sacramento this year. Because we are in still a COVID environment, timelines have been kind of shortened and truncated. So bear with us as things kind of shift and change, but we are on the ground and keeping an eye on everything. And again, happy to be a part of the team. I'll kick it over to Erin.
Hi, Erin Levi. Ditto exactly what Kathy said. This year is going to be very strange. It's not going to look like anything that you've seen before. Kathy and I have been doing this for decades, and we are certain it's going to be like nothing we've ever seen before. If it does look different to you and we're asking for something or appears to be frantic, it's because we were just told something is due. So just please be patient with us as we are patient and nimble with the process. We're very, very sensitive to your time and your workloads. And so we will only be asking you to do things when we know it's of utmost importance. And right, Kathy and I go way back on health and human services issues. And when we were first talking with Mark and Kevin and Jackie, we realized that we've probably sat in room 4202 and 4203 with many of you folks. So nice to be working with you all. We're very excited.
Thanks so much to the both of you. And we are just so excited to be working with you and look forward to all the hard work we have ahead of us. They've assured us that they're in it to win it. So we are excited to have them on our team. So thank you. The first speaker that we have is someone that has a long history with us as a network. Laura Bracken from Bracken Associates had done some real statewide speaking back in the day of the new final rule for HCBS compliance here in California. We engaged her back in the day to talk about, and if there are SLS providers on here, the complexities between IHSS and SLS, and she worked really hard with us back then. We've also started to reach out to her on this project. We wanted a national perspective, and Laura was able to provide us with that. So I want to introduce Laura Bracken to give us sort of a national perspective on PAVE. Welcome, Laura.
Thank you, Mark. I'm really excited to see this coming to this point, to see AB 813. On a national perspective, tracking and measuring outcomes and quality has been a long-standing problem in this field. And currently there's not any comprehensive national or state level set of measurements. And what's really challenging is that in the past 10 years, we've seen a lot of changes to how services are delivered in this field, which changes how you're supposed to measure those outcomes and how you're supposed to look at what quality is. And the federal government's been seeking ways in the past decade to address this issue, but all of the ways that they've been looking at don't address it completely and don't address service outcomes. So this is really exciting to see what y'all are working on in California with CCLN. You know, the benefit to the state at the state level is to have that, that those outcome measures identified by the providers that are actually doing the work, that see what service outcomes look like, to have that influence what it looks like in your own state. But it would be absolutely fantastic for this to serve as a model for other states. And what I hope will happen is that it winds up being adopted nationally. If it is adopted nationally, it would help the federal government make comparisons across states. And ultimately the benefit is to the individual that receives services. So states can look at, what's working and what's not working, and continually improve on how they provide services so that they achieve better outcomes and higher quality. So it's just really exciting what you're doing, and I'm happy to have been a part of it up to this point.
Laura, thanks so much for that perspective. We echo that. Oftentimes, as California goes, the rest of the country goes, and we hope that this applies here as well. So thank you, and I'm sure we'll be reaching out to you in the future as things progress, because you've been so helpful. So thank you very much. Our next speaker is Amy Weissling from the Association of Regional Centers. And Amy is also somebody else whose door we knock on quite often, and in our new virtual world have had a lot of really important time with her, and want to thank her for throughout this pandemic really collaborating with CCLN on all these issues, but as well as the PAVE project. We engaged her back in January of last year when we just had a framework paper. Kind of kept her up to speed as our work progressed, and really want to thank her for being here with us today to talk about the statewide need for service outcomes. So welcome, Amy. Thank you.
Thank you so much, Mark. And wow, was it only January last year that we began having these conversations? It seems like such a lifetime ago, and I'm sure for many of you feels that way as well. I am just excited to be here today, and excited that we're at a point in this public health emergency where we're able to begin thinking about what's next. For those of you that heard the budget hearing that took place earlier this week, it really was an opportunity to take a step back and say, what have we learned? And one of the things that we know that we've learned is that services and supports for people with intellectual and developmental disabilities need to be as personally tailored to meet their needs as possible. And really, you know, then we begin to ask the question about if we're not thinking in terms of quality being measured by adherence to regulation or statute, how do we figure out what's working and what's not? We are incredibly fortunate in the state of California to have an entitlement to services for people with developmental disabilities, and it really sets us apart. But we also have an incredible responsibility to then figure out what is working to meet the needs of people. This is a system that needs to be flexible, that needs to be nimble, and needs to be responsive to people's needs. And we've seen over the more than 50 years of service delivery that times change and people change and their expectations change and what they want out of their lives change. And our collective responsibility is to make sure that the services and supports we're providing to them really are responsive to their needs and really do help drive them towards their individualized goals. But as the previous speaker noted, we aren't in a system where we have the luxury of some well-designed outcome measures on the personal level. So if you think about healthcare services, there are opportunities to measure health systems against each other from one state to the next because there's a clearly defined outcome. And for our service delivery system, there isn't. And some of that comes down to each person has different goals they're driving towards, but some of it comes down to really just needing to take a step back and figure out what are we hoping to achieve with service delivery. And how do we effectively know when we've hit the mark and when we haven't? Because that gives us the opportunity, both on the individual and systems level, to take a step back, to tweak things and to make adjustments, ultimately for the benefit of the 350,000 people and counting that this state is serving in its developmental services system. So delighted to be here today, delighted to learn more as this bill progresses and begin to understand what would this look like as we think about, again, this question of outcomes, and most delighted that we're in a space right now where we can have these bigger conversations, where the rest of the world has started to calm down a little bit. While we're still in a pandemic, we're beginning to think ahead to a time when we're not, and what that will look like, and what we've learned through this period that we can apply going forward. So really appreciate the opportunity to be here with you today. And thanks, Mark, for asking me to say a few words. So thank you.
Absolutely, Amy, and thank you for saying a few words. Amy's someone that we've bounced these concepts off of throughout this past year, and she's really provided us with some amazing feedback and input on on the work that we're doing. So we continue to look forward to that opportunity to do that with you, Amy. Thank you. Let's see, our next speaker is Jennifer Kent, and I'm not sure if I see her in the panelist or the attendee list. So we may need to come back to her. So I will now move on to the deeper dive into what this bill is proposing. I'd like to introduce Kevin Rath. Kevin is the Executive Director of Manos, as well as the Vice President of the California Community Living Network. Kevin, welcome, and thank you for all your hard work over this past year. I am going to share my screen because I have Kevin's PowerPoint presentation here. Give me one quick second. Okay, can you all see that PowerPoint? Welcome, Kevin.
Hi, can you put it into read mode?
Yes. From the start. Here we go. Now, just let's give a second, Kevin, to make sure that we can see both interpreters as well as the PowerPoint for folks. And as you will see, we do have some closed captioning as well. So hopefully that's working for our attendees. Kevin, take it away.
Okay, thanks for your time, everyone. And this is the unveiling of PAVE, Person-Centered Advocacy, Vision, and Education. And bear with us because this is actually the first time we've publicly presented these concepts. That, as Mark had mentioned, there's been years of work on this, and actually at this point, if you include the market rate study, competitive wage study, which PAVE builds on, we've got something like 300 pages of reports on the research that we've been doing, and maybe and the other thing is even though those reports were written and rewritten with critical insights from people like Laura Bracken and Dr. Julie Beadle-Brown. So we want to thank people, the advisory committee, the PAVE advisory committee, and all the experts that contributed to helping us get to where we are today. Next slide. So one of the basic fundamental concepts that PAVE uses is ways of life. And ways of life are the things we do. They're patterns of behavior. They're fundamental, what we call lifestyle practices that make up who we are and how we live. So that can be going to school if you go to school, or hobbies, what you eat, what you do for entertainment, where you live, how you exercise, if you work, if you do other things. It's all of these things and more. And next slide. Sometimes we get to choose our way of life, and sometimes we don't. In the developmental centers, institutions drove the services and also how people use their services for the limited opportunities they had to engage in their chosen ways of life. So, so now that those centers have been closed through advocacy of people who are here and through others, we now have community-based lifestyles, and that presents another challenge. Next slide. How do we go from an institutional model to a community-based model? And so there's a lot more work to do. So to choose our ways of life, we need access to the lifestyle we want, whether it's about swimming or just staying alive in a pandemic. Next. Access to our chosen ways of life are, you can think, another way to think of it is to think of it like a key to an apartment door. If you live in an apartment, you need a key to get into it, or you're not going to have access to that apartment. So what we want to really think about is not just apartments, but all kinds of lifestyle practices. And for the developmental disability community, we have to ask, how can people with developmental disabilities get access to the lifestyle practices they want? And also, how do they keep that access? And that's something that's been often overlooked. In our goal-obsessed society, we often just look at event-driven goals. And once you get something, like once you get a driver's license, or once you get a bus pass or whatever, that's it. When actually life is a process. And so maintaining those access points over time so that people can engage in their lifestyles is just as crucial as the events that are needed in order to get to those ways of life. Next. So let's look at an example. Let's take swimming first. And there's basically 3 access points, because accesses can be divided up into different parts, and so we just call them access points. So that's the first one is you have to know how to swim if you want to swim. You have to have a place to swim, and you have to be able to get there. So those are the 3 access points, the 3 conditions that are needed in order to swim. So if someone wants to swim twice a week, they have to keep those access points, right? They all, as well as achieving them. So if the pool closes down, if they have a pool next to them and the pool closes down, well, then they lose their access point. So it's achieving and maintaining that access. Next. So what about the pandemic? Well, how are being healthy and safe in a pandemic possible? Well, here are some access points, and there are probably more that are needed for being healthy. So we often talk about health and safety as some kind of noun, but actually, and it is, and you can say it as a noun, but it's also a process. It's also about how you live your lives. It's about how you are in the world. So it's about being healthy and being safe. And what does that mean in the pandemic? Well, some of the access points are wearing a mask, social distancing, healthcare if you do get the coronavirus, diet and exercise to boost your immune system and keep you protected. And then also, of course, for those who choose to get a vaccine in order to become hopefully immune, but to further prevent the possibility of getting the coronavirus. Next. Supports are essential for people with developmental disabilities in order for them to achieve and maintain their access points. And that's actually where we see the role of developmental disability services being contributing to people's ways of life. And here we see an example of what that service is. We see a direct service professional, because direct services in the developmental disability field are delivered by direct service professionals. That is the essence of service delivery. Next. So there's a cycle here for bringing services into a person's life, and the first one is choice. You have to choose the service that you want, and in order to do that, you need to have clear service options. They have to be clearly defined, or else you don't know what you're choosing. Then the services have to be delivered according to those definitions, and then they have to be used. So it's a cycle, because after you use some services, you may choose others. And this cycle creates the ability to acquire access points. Next. So let's take, let's expand our example with swimming. So let's say that a service user is working with a case manager and their support circle, and they decide to choose independent living skills as a service in order to engage in the lifestyle practice of swimming twice a week. So what they do here is they choose, how does that happen? Well, the case manager usually gets a purchase of service, and together they identify an agency, a service agency that provides this. So the DIA, and what do? That means the service provider sends a trained and paid DSP to help the person get to those access points. So the person would help them find a swimming pool near their home. So let's say they do that and they find a pool. They investigate the transportation and they decide, well, the service user can't afford a car or doesn't have one, and so they identify a bus route that they can get to, and then they also identify a swimming class because the service user doesn't know how to swim yet, and so the direct service provider encourages the service user to take the classes. Maybe that person skips one, and the service provider, the ILS instructor encourages them to keep going and not get discouraged. And so they finally finish the classes and now they know how to swim. So now the service user can use those access points to swim twice a week and engage in a chosen way, their chosen way of life. Next. So let's talk about another, an issue that's important in the pandemic, and that's getting a vaccine. So, here, let's say that the service user is using supported living services and transportation services. So, the DSP search, and maybe in conjunction with other people, perhaps the case manager, searches for the right site. It may be that the person has to get a vaccine at home and it would have to arrange it. It may be that they don't want to go to a big Coliseum type area. Maybe there's a local drugstore by. So that conversation happens and that planning happens. The DSP contacts the vaccine schedule and makes an appointment, schedules the van that accommodate through a transportation service, usually provided by the regional center. Because this person happens to need a wheelchair, they get a van, they make sure that a van has that wheelchair accommodation. And so the service user goes with the DSP to get vaccinated. And so the service user achieves an important event in their way of life, which is getting vaccinated. Next. Well, this is not, you can't get people just like, so to speak, off the street to do this kind of job. This job requires cultural sensitivity, so they have to be cultural competent. There's probably hundreds of different types of cultures and communities, ethnic communities, different sexually orientated, all kinds of communities in California, and people have to be sensitive to those or they'll alienate the service user and nothing will get done. So we need to make sure that these professional services provided are provided by competent, trained people. We can do that, but we have to have competitive wages. Competitive with what? Well, some gas station attendants earn more than DSPs in the system, and that's a problem. If the DSP is trying to pay the rent and trying to live their own life, sometimes they're forced actually to quit jobs that they love and take jobs that just for the money. We want to stop that, and we feel like it's going to be impossible to move forward, because what happens is if you train direct service professionals and they quit, all we're doing is training them for other occupations. We're not training them for the occupations that are the occupation of direct service professional provision, service delivery provision. So that's one of the reasons why we did the market study, and that is the role of the market rate study that CCLN did in 2019. This market rate study links funding to quality service delivery. And that the second part of that is PAVE. Next, please. So how do we measure the results? If we don't measure them, we're not going to be able to connect the funding to the quality outcomes. Now there's more than 4 types, but for now, I think there's 4. We can identify 4 major measurement points from the processes and the analysis that we just described. Service choice, so people have to choose a service. Service delivery, the service is delivered. Service use, how that service delivery is used to access their ways of life. And also finally, lifestyle engagement. Actually, did the service user actually engage in the intended lifestyle practice? Next. So let's look at these one by one. One is service choice. So what's the ruler, that is, what's the measurement tool that we're going to use to measure service choice outcomes? Well, we call it the service match. So was the service user able to access the service? Did the service provider help them reach the access point? let's take swimming as an example. Well, we chose, the case manager and the service user chose independent living skills to help the person do that, to help the person learn how to swim and get to a pool. Now, if when they were looking at the service deliverables and they didn't notice that this service user speaks Spanish and does not speak English, and they sent an English speaking person, then obviously that match is going to fail. If they notice that the person spoke Spanish and the service deliverable was defined that way, and they successfully chose an agency that had people that spoke Spanish, then you've got an appropriate match. So that's just a simple example, and we'll leave it at that for now. Next, please. The net service delivery is the next thing to be measured. So what's a yardstick for that? Well, service definition. Was the service delivered the way the service is defined? So if someone needed Spanish, what did they send somebody who didn't speak Spanish? That would be a failure in the service definition. Let's say somebody, the ILS instructor, instead of helping the person gain the access points needed to swim, just sat at home with the person and watched the Olympics and watched people swim. That would not be an appropriate deliverable. Or tried to do it, or tried to teach, try to get all those access points through some kind of virtual service without ever going to the home. That's probably going to fail. And so this is why why it's so crucial to have in-person supports. And these are the kind of things that we can also start articulating and understanding when we start using service delivery outcomes. Next. And then we have service use. So here we have service user outcomes. So and the measurement for that is access point acquisition. So did the service user, was the service user able to get to all the access points required to engage in the lifestyle practice that they intended, that they targeted? And in the swimming example, we could just simply say, did they learn how to swim? Did they find a place to swim? And did they find transportation that could get them there? And if they didn't, obviously that failed. Now, it could be a problem with all kinds of things why that didn't happen. Maybe they never found a pool. Maybe there isn't a pool. So it's not always the service deliverer's fault. It's not always the service user's fault. It just may be the way the world is at this point. And right now, there's not a lot of people swimming, right? During COVID. So maybe we have to wait for those kind of things. Next. And the last measurement point we're gonna examine is lifestyle engagement. So, you know, and the metric there is activity tracking. So this is what most people think outcomes are, and it's true. This is an outcome. Did they swim? Did the person actually go swimming? And that's the common sense outcome. But what PAVE is trying to say is, yes, that's important. And yes, we want to track that. But that is the tip of the iceberg with outcomes. And so one of the innovations of PAVE is to actually create language about service delivery and service use, and use that language to understand the whole process better and to find out how to measure it and how to find out how to improve it, which is another thing that we're going to be working on in the pilot project. Next. So how do we make all this happen? Well, we can thank Assemblymember Kevin Mullen for authoring the DDS Service Outcome Pilot Project, and this gives us an opportunity to, if this bill passes, then we have an incredible opening to solving a problem that's getting more attention, but that has always challenged the community as people with developmental disabilities try to live their lives successfully in the community with the services that are provided. Next. So step one, we got to develop the tools, right? So we have to get clear service definitions so that people know what they're choosing. We have to develop outcome-based training curriculum so that direct service professionals know what they're supposed to deliver. We have to have a service selection software with an online service menu so that it can be easy to choose services, and also so that we can track those choices in real time without a bunch of unnecessary data entry. And then we also, of course, have to have internet-based surveys and outcome tracking databases so that we can ask service users, their support circles, and other stakeholders about the success of the service delivery, service use, service choice, etc. Next, please. And then we have to apply these tools. And I really want to emphasize just from the start, if we do get this bill and we do have a pilot project, it is so important not to rush to this step. If we don't do the service tools right, we will certainly fail at applying them. But let's assume, if we do get there, if we do develop the tools, then we'll have to train all levels of the service system, and we'll have to train service users in their support circles so that we're all talking the same language and we're all on the same page. We need to roll out the software. We need to survey stakeholders and analyze the data, and we'll use the data for service improvement. And this will all be documented in reports that the state and other stakeholders can access. Next. So I'd like to introduce Dr. Julie Beadle-Brown, who's the professor at the University of Kent, England. She's done some amazing work on training, as Mark has mentioned. So Dr. Julie, are you there?
I'm here. Hello, everybody. Mark, is it okay if I share my presentation? It should do the subtitling.
Wonderful. Absolutely, Dr. Julie. Feel free.
Let me just make it work. Okay, hopefully you can see my presentation now, and all being well, some subtitles. Yes, okay. So thank you very much for the opportunity to join with you. I was going to say this evening because it's this evening in the UK. Obviously it's lunchtime with you there in California. So Kevin asked me to say a little bit about the importance of training and linking it in with what he said. Kevin, having listened to you, I've been amending as I go. So what I sent you earlier is not quite what I have amended slightly my presentation from what I sent you earlier. But just to kind of go back perhaps a little step from sort of before we mention the training, and to say a little bit very briefly about what research has told us is needed for better, and the phrase that we often use in the UK is quality of life, but it's essentially the same. It's way of life. It's how people live their lives, the opportunities they have, the things they get involved in, whether they have choice and control, etc. And over 50 years worth of research, we know that one really important thing, which is an ordinary home dispersed in the community, is necessary, but not on its own sufficient to bring about a better quality of life or to bring about access to opportunities for individuals. We also know that having enough resources, and in most cases for people with intellectual and developmental disabilities, that means staff, is needed. And actually, we know that we need enough, but not too many. We know that we can add lots of staff and make absolutely no differences to people's life, to people's quality of life, if they're not doing things in the right way. We know that ways of working such as person-centered planning, person-centered thinking, and even person-centered funding, like individual funding, personal budgets, direct payments type of arrangements, those are all very important, especially for choice and control, but are not, again, enough on their own, especially if people have more severe or complex needs in that sense. So over the years, actually, really interestingly, only 2 things have ever shown in the research as consistently important for delivering good outcomes for individuals in terms of quality of life and their that has been their own level of functional skills or the severity of disability, but also the nature and quality of the support provided. Yeah. So in other words, how people are supported, and that support essentially needs to be compensating for the severity or complexity of people's needs to help people to access their opportunities available to them. So what has research and practice shown that support looks like? What does it, what do we know about that? Well, we know that the support is a type of support that is about enabling people. And we use the word enabling. And it's about enabling people to participate in all aspects of their life, in their home and in their community. Enabling is about doing with people, not for or to people. And in the work that we do, we refer to the phrase, every moment has potential. Every moment has potential for people to participate, to interact with others, to learn something, to try something new, to learned last week, to sort of get some experience with which to make a choice in the future, kind of thing. The other thing that we know is that support provides just enough help and support for the person in that activity at that time to ensure success. We refer to this as graded assistance. It's support that works at the pace and with the preferences, interests and agendas of the individual. In other words, person-centered in that sense. It's support that maximizes real choice and control every minute of every day, not just the big decisions like where do you live or do you have a job. It maximizes choice and control, as in which way round do you want to do the shopping? Which aisle do you want to go up the supermarket first, for example. And it's support that can offer this support and provide these opportunities irrespective of the level of intellectual disability or the presence of any additional or complex needs. In other words, nobody is too disabled, too autistic, too difficult, to anything to have a better quality of life. However, they may need more skills support to be able to access the opportunities. And we refer to this as person-centered active support. Okay. So an active support, these pictures just provide a brief, a kind of overview in the sense of it's about warm interactions and skill support for people to be actively involved in everything that they do. So on to training. What do we need to make support like active, that looks like active support happen? Sometimes this is the way of working that we find in services without them having to do anything. Staff just naturally work in this way. But actually, I've written it's not always the case. Actually, to be honest, it's rarely the case without intervention or without support for staff. The research that we've done over the years has told us that only around 1/5 to 1/3 of people accessing services where they are having supported accommodation type services, including those in supported living. So, and even those in an individualized service, not living with anybody else, just in their home, in their own, they don't receive that support very often without something happening. And what we know is that in order to make it happen, we need two things. We need the people who are providing the support, whether that's paid staff, paid carers, whether that's a family member, whether it's in a school and it's a teacher, but people need to have both the skills to work in this way and the motivation to do so. Yeah. Oh, I'm sorry. I've just realized that my slide didn't move forward. I'm really sorry. This is the slide. The skills and the motivation to do so. Okay. So the importance for training. Obviously, there's an important point here that in terms of the bill and in terms of developing any system that's about measuring quality. And it's a methodological point, which is why training is really important to think about at this point as well. That if you're going to develop good measures of quality, you have to test it in a range of services, which must include really good services. You have to have a whole range of services if you're going to know whether your measures work. And therefore, we have to invest very early on in ways of ensuring that you have, sort of the very good end of the quality spectrum, if you like, in order to use and develop any measures. Training for frontline supporters, we generally have found in research that if people have had training in active support, that this becomes a foundation for anything else that they do. That they can build on this with other elements. When we're working with people with intellectual and developmental disabilities, the staff, anybody providing support might also need training in, for example, understanding and supporting people who are on the autism spectrum, supporting communication and decision making, maybe even understanding behaviors that challenge and what we might call positive behavior support, or ways of working with individuals in that sense. So they may need other elements of training as well. So training becomes, having the right curriculum of training becomes really important. But training is not just for frontline staff or for those who are direct support workers or direct support personnel in services going into people's homes. Actually, there's a range of support that we know staff need in order to be able to do this well. And that includes what we call practice leadership. So that includes having somebody who is able to provide ongoing mentoring, modeling, coaching, supervision, etc. And they also have to be knowledgeable and be able to work in this way in order to guide and support staff to do that. However, I mentioned on the previous slide about motivation. And actually, it's really important that senior managers and funders and commissioners have at least a basic awareness of what good really looks like and what their role is in making it happen. It's about getting the motivational structures correct. If for example, the measure of quality is how many activities have been ticked on a sheet, what you will often find is that staff get really good at completing pieces of paper with ticks. Yeah. If people realize that actually there's more to it and that they're really interested in how that the support is provided, the quality of support, the relationships and the rapport, for example, and that message comes from senior management and from outside of the organization, then you're much more likely to have success. And finally, of course, those who are responsible for checking quality need to have training so that they know what good looks like and what they should expect to see if those providing support have been given the skills they need. One little example from the UK was that for many years, and even now it could be a lot better, but our inspectors in our registration and inspection body have never, they never have really used, they go into services, they visit services, they might talk to people who can talk, they might talk to staff, but they don't always spend time watching and thinking about what's going on. And sometimes they will make a lot of excuses that, oh, well, that person's got very severe disabilities. They can't do anything. They can't be involved. You know, it's okay for staff to just leave them. Or I've even seen people write not appropriate on a report against activities for somebody with profound and multiple disabilities, for example. So it's really important that whoever's looking at quality knows what to look at and look for in that respect. So how can training be delivered? Because obviously, as Kevin said, this could be an awful lot of people needing training. And of course, there are many elements of the training that can be delivered through e-learning and online methods, but which we can also make interactive. Although the interaction is always much better if we have the luxury of being able to have people face to face. But it's still really possible to do that. And we can make training available to many different supporters to ensure consistency across different environments when we use those types of methods. Yeah. And just as an illustration, I was asked to mention some of the work that we do, for example. So I don't know if you know what MOOC stands for, but it's basically a massive kind of online learning kind of course. And we have one on autism. And it trains between 10 and 15,000 people on each go. And we have trained almost 110,000 people in less than 4 years, running just 2 courses a year. And people are across 150 countries. Yeah. People say it changed how they think. It changed how they think about autism, their views, their attitudes, and how they work with people. And so we know that it's possible to deliver really powerful training in that sense. In addition, we've already trained almost 500 staff in California on the principles on the introduction to active support, plus several thousand other staff, either directly or through those we train as trainers across different parts of the world. And materials on things like active support and understanding autism already exist in electronic format at different levels. It would be relatively easy to create a Californian version effectively for use. And also other elements of training are also being currently developed around, for example, training frontline managers to be practice leaders. So there's lots of materials out there. However, it is really important to note, and this is a kind of key point to finish on, that just giving people online training is not enough, and therefore investment has to be made in creating a system whereby staff can have the option, can have the possibility of coaching and modeling and training in situ. We know that very frequently staff need help to take the concepts and the ideas that they hear or read about in training and turn them into reality for the people that they support. And therefore we have to think about training, for example, excuse me, a network of local mentors and coaches to support staff development and improvement over time. And also think about supporting the local mentors and coaches in a form of a network to keep their practice up to speed and fresh over time and consistent. And also things like establishing a community of practice among senior managers, funders of services, etc., so that the good practices and the awareness stays at a high level. Okay. So the last thing that Kevin asked me to speak about was something about the sorts of things we have to think about in terms of the costs associated with training in these types of approaches. Now, obviously, there is a cost around curriculum development and the development or adaptation of high quality resources. You want something that's going to work well, make it easy for people to use, and sort of have the technology with it that will make it work if you're going to use, for example, online platforms as part of a way of delivering training. There is also a cost of consulting stakeholders about the curriculum and the materials, and this is really very important. people themselves who are using services, as well as obviously other stakeholders. Ensuring and maintaining a reliable platform on which to situate e-learning resources. This is extremely important. So having somewhere where the resources can sit and be well maintained and updated as time goes on is really important. We have to cost in, for example, facilitators for the interactive elements of online training. Who's going to feed back if they have a discussion on a forum? Who's going to make and give views and experiences for people to share, etc. The cost of training and providing ongoing support to a network of local coaches and mentors. So training people up, enough people up, and over time. And then, of course, there's costs like the release of staff to complete the training. It is actually really important that everyone does the training. This is often about changing hearts and minds as well as giving skills. And we know that what we sometimes call the cascade model, where you train one person and expect them to go back to a team and kind of tell everybody else what it was about, it doesn't work. This is something that every person every member of staff has to experience and participate in order for that to happen. And of course, then there would be the other cost of releasing those chosen and trained as coaches and mentors to provide the in-situ training and ongoing support to staff and those in practice leadership positions. So there would be a kind of a second set of release costs for that. So I hope that covers all the things that people had hoped that I would cover, and very happy at the end if there's any questions or anything that people would like to ask. Okay, thank you.
Whoops. What are you seeing here? All right, Kevin, do I turn it back over to you? Julie, thank you so much. It has been such a pleasure to work with you, not only because of your great accent, but also kind of the amazing information that you've provided us along the way and really made some substantial changes to what we were working on midstream in the project. So we want to thank you and appreciate you for that. Kevin, I'm going to share your slide deck again.
Please do that.
Thank you.
And yeah, Dr. Julie was the one of the people who, she actually made me rewrite the service outcome paper twice. So, but it was good. It was important. I'm glad I did it, even though I complained. So could you go to the next slide, please, Mark? There. So how are we going to collect the data? And thank you, Dr. Julie. I hope to meet you in person someday when this pandemic is over. And I really want to thank you again, though, for all of your input on crucial input on our research. So how are we going to collect the data? Well, I want to give a shout out to Ken Arcada, who is the CEO of Encoda and helped us work on this, and also Lisa Cameron, a researcher who we retained and was unable to be here, I believe. Both of them were crucial in helping us understand this, helping us figure out how to do this. It's a prototype. It's not up yet, but hopefully it will be up in a month or two. We call it the Service Story Portal, and you can upload a service story about your services, and it's you can do it through a video, through pictures, through written words, and then we ask some questions that are based on the service measurements we discussed previously. And this isn't a scientific sample or anything. It's really a warm up, and it's also just to demonstrate what it looks like to actually get data about service outcomes. We think that this is one of the first, if not the first times somebody's ever tried to do this, and we're really excited about it. And we'll keep you posted on that. And this is something that we're going to be doing even before any bill is passed or any other funding is provided. We also want to thank the State Council on Developmental Disabilities for providing a grant for PAVE and also helping us fund this service story portal. So, the next slide, please. So I'd like to introduce Dr. Din Chen, who's been very helpful in providing some insight and guidance into how to measure service outcomes. Dr. Din, I just want to give your presentation.
Okay.
Which are you seeing? Which one are you seeing?
Still seeing mine.
Okay, one moment, please. Nope. Okay, give me 1 minute. Nope, still not doing it. Hold, please.
You were good, Mark. It worked. It worked.
Oh,
the last time.
Oh, okay. It's not showing on my screen, but it must be showing on yours.
There. It's
here.
And slideshow from the beginning. Here we go. How's that working?
It's working. It's working.
Welcome, Din. Thank you.
Yeah, thank you. Can everyone see this? So now, anyway, my name is Din Chen. So I'm the Director of Statistical Development, and also now I'm a Wallace Curate Distinguished Professor at the School of Social Work from University of North Carolina at Chapel Hill. My responsibility is to develop social work service and methods for intervention research. So now today I'm going to talk about my involvement with the PAVE project and then my excitement about this project. So next slide. So my involvement with this project. So now, first I want to show off you the slides of the Deming framework. So now a few years ago when I have been involved with the Deming conference and Deming organization for the last 15 years. So you might ask, now who is Deming? So Deming actually was a American engineer and a statistician, and also he was a governmental consultant for quality management. So he basically changed the whole industry in Japan and in the United States. So there is an organization dedicated to him, and also several national, international conferences with his name on. So now one of the conferences is called the Deming Applied Statistics Conference. I have been involved for the last 15 years as a speaker and also as an organizer. Like 3 years ago, when Kevin came to this meeting, and then we met, and briefly Kevin talked to me about the PAVE project, and then I was so excited. At that time, I told Kevin, this is exactly the project formulated with the Deming framework. So the Deming framework is the Deming model for total quality management. So the core concept of the Deming framework is on implementing the total quality management practice to social services agencies to increase their quality and productivity. So the core of this framework is the continuous service improvement, which is exactly match what is PAVE is doing. So that's why I have been very excited when Kevin talked to me about this. Since that time, we had a lot of emails, phone calls, and Zoom meeting with Mark and Jackie for the last 2 or 3 years. So now I'm going to, so that's why I'm so excited about this project. So for my involvement, and also I would like to talk about my understanding for this PAVE project. Next slide. So I would like to say the innovations for this idea, for this framework. So we all know nowadays we have problems and challenges associated with the community of developmental disability. The first one is the rising cost for the services. So we all know of that. The second challenge, of course, is the lack of data to evaluate and quantify the quality of services. So to deal with that, so PAVE actually provide a solution. So it's evidence-based solution. So nowadays we talk about evidence-based, evidence-supported solution. So PAVE project is innovative. So to pilot data collection, use the service portal. Like Kevin just mentioned, you know, we have developed the service portal. So from there, we can collect the data. So, and also this project is unique. It's a unique approach to simultaneously synthesize qualitative data. For example, like the stories told from the portal. So we can use some kind of text mining, artificial intelligence to mine those data to get some information. And also we can collect quantitative data, for example, from the questionnaires with item responses. So the project is a framework to simultaneously analyze these two types of data together to come out with a better solution. So and also this project, you know, this project will be a probability sampling survey design. So we can use this probability design to reduce bias. And then, of course, you know, the whole project is evidence-based, supported service evaluation for the DDS. Next. Yeah, so now as the framework, I would like to say a few words of the framework. So the first one is we plan to do a 3-year pilot development. So we're going to pilot testing the three regional centers and pilot testing for at least 4 service types. We would like to involve the randomized control trial. Okay, the randomized control trial is regarded as the gold standard in evidence-based service evaluation to use probability design with volunteers from 3 regional centers. So as a gold standard in evidence-based service evaluation, I think the PAVE data collection and then data analysis will be very successful. Next, please. So the action plan, as outlined by Kevin, so we have stage one. Stage one, so we are going to do a pilot testing, pilot data collection with 1 regional center and 1 service. So in this case, you know, in this stage, we're going to develop the matrix, test the matrix, and then test the methods on data collection and the data analysis. So with the success from the stage 1, we can go from the stage 2 to add more regional centers and the services to collect more data and more analysis. So with the success from the stage 2, and then we can expand it to the rest of the state. So next. So now I have been very excited about this project. So every time when I read the documents from Kevin, Mark, and Jackie, and then also I'm excited about the bill. So to me, I think this project will be nationally and internationally known, like what the previous speaker, Laura Bracken, said. So to me, this project is on the general theory of social services and management quality improvement. And then this project will be the first, we're going to develop the first toolbox in the developmental disability system for understanding the purpose of services and how to measure the success from the perspective of people, people-centered, people who use them. So with success in California, we can easily, extend the framework, the success to all other states and even other federal agencies, maybe even other type of services. So I'm confident, so this project will be the next David success for service management. So now that is all for me. I'm so excited about this project. Thank you so much for the opportunity to talk here.
Dan, thank you so much. It's also been such a pleasure working with you, hearing your words of encouragement for what the potential for this type of project could be. So appreciate your work with us on this. It's really been critical in our encouragement, and the advice that you've given us has just been invaluable. So thank you so much.
Thank you.
Kevin, am I going back to your presentation now?
Yep, I got just a little bit left. I'll try to be quick.
That's okay. We are doing good on time. Let me just find yours. Here it is. Okay. Play from current slide. Go back. Share. Okay, are you seeing yours?
Yes, I am. Thank you.
Okay, I am going off camera and going to the next slide.
Okay, so just as Dr. Din said, and thank you, Dr. Din, I was so happy to meet you at that conference, and it was almost by accident. So it was certainly a great accident, and I appreciated all of your very technical lectures at the conference, and we will need your expertise to make this work. I really do think that that's just an assumption that I work on all the time. That's how I assume that as I work on PAVE. So we really hope to get this bill passed and get to work with you.
Thank you.
So this is what Dr. Din was talking about: continuous service improvement. And we call it a circle of excellence, where you define service outcomes, you train staff in outcome-based training, you do the data collection, you do the quality analysis, and then you upgrade the system. And then you integrate those system upgrades into service outcomes. This is a virtuous cycle. There's lots of names for it. We believe that we can do this. We don't think it will be easy, but we believe that we can do this. We're going to need a lot of help from a lot of different people. And as you can tell, PAVE brings together a variety of disciplines. We do not want to reinvent the wheel. We want to build a new wheel from existing parts. And when we can't find those parts, we will figure out how to make them. Next, please. So just to recap, AB 813, the DDS Service Outcome Pilot Project, 3 regional centers and at least 4 service types. That's our goal. And then if it's successful, which we hope it will be, then we'll get on to the ambitious agenda some other speakers like Dr. Din has outlined. I'd be really happy to just get through this project first, and then we'll see where we're at then. Very excited about it. Next. So this probably didn't come out that great, but there, in the Middle Ages and earlier, in Europe at least, people believed that the sun revolved around the earth. That's the geocentric theory, right? And in the Renaissance, we had what was called the Copernican revolution, where Copernicus and people like Galileo and others took the problems that people were experiencing in the geocentric theory and realized that a different model resolved those problems. And it was a revolution in understanding astronomy and understanding our role in the universe. And it's called the Copernican revolution. Next slide. So in the institutional model, people with developmental disabilities revolve around service providers, right? And service providers are the center of the universe. And service providers get to provide services and tell the people who receive them how to use those services. And then what happens with funding here is the funding then just becomes, well, I need more money to provide the services that I'm providing. And then there's all kinds of cost reports and estimates and complicated things that in one sense are extremely important. But as we've seen, that kind of service provision and service funding is breaking apart, and it's not serving people in the community. It's not supporting access to their chosen ways of life. And we can do better. Next. We have to reorient ourselves. Service providers have to revolve around the service user. Service users need to determine the meaning of their services by choosing their services and choosing how to use them for the lifestyles that they want to live. Next. That's it. Thank you, everybody.
Thank you, Kevin. And thank you to all those speakers. We have sufficiently probably overwhelmed you with information. I am going to put in the chat just our website for ccln.org. There is a tab on that page that's called AB 813 PAVE. And on that tab, you'll find the fact sheet for the bill. You'll also find below that, if you scroll down, you'll see our a few of the preliminary reports. So there's the introduction and the executive summary of the report. So for folks that want to do a deeper dive and enjoy reading, there is some good information on that website. Also included on that website is the competitive wage study. So just an opportunity if folks want to look a little further into the concepts and where we're going with the pilot project. A lot of that information can be found on our website on the tab that's called AB 813 PAVE. So do take a look at that. So next we wanted to kind of feature some of the folks who really embarked on this journey with us a year ago. Folks that were on the PAVE advisory group. So we've invited some folks that worked with us throughout the year. It began with our very first in-person meeting, and then the pandemic hit and California shut down. So we immediately moved to a virtual format for our meetings. As you'll see on the screen, we're starting to line up the folks. There's one more, Joseph Metters, to add, but I'll quickly go around and introduce those folks, we're going to ask them a couple of questions about how that journey went for all of us, and talk about how we got to where we got to and where we're at. So first on my screen is Kimberly Mills. Kimberly Mills is Executive Director of A Better Life Together, as well as a CCLN board member. Edward Amy is next. He is the Executive Director of J. Nolan Services, and also an active member in our CCLN membership and a PAVE advisory group member. Elizabeth Grigsby is the rights advocate at Golden Gate Regional Center, and also went through this year-long process with us. We've invited two of our more vocal self-advocates to this panel because they had a lot of input for us throughout this journey. And Joseph Metters, who is an amazing self-advocate state and nationwide. I welcome you all, and just really can't thank you guys enough for all of the time that you spent with us to go through these concepts and understand what we were doing, to provide your valuable input and feedback on where we were at. So I'm gonna just start by posing questions and maybe give each of you an opportunity to respond if that's okay with you guys. And the first question I have for the panel of advisory group members was, what was it like to even be asked to participate in this, and how did you feel about it from the very beginning? So I'll start with Kim. Kim, how is this process for you?
It was exciting actually to be a part of something groundbreaking, and just I enjoyed the first meeting in person, but then I was actually quite excited about just doing it on Zoom because the travel, but I did enjoy the food. But just getting input from everybody, and everybody's voices matter. Sometimes we have those work groups where, yeah, it's representative by everybody, but everybody's not, their voice isn't really listened to. And the fact that we had self-advocates there and really listened to what they had to say about it, and had parents there too. It was just a wonderful process just to get, like, you guys sent the message that our voice really does matter. We have a really huge part to play. And so it was really refreshing to be a part of something like this.
Thanks so much, Kim. And I must apologize. Lydia Edinburgh has also joined us. Lydia Edinburgh was able to lend her voice to this PAVE advisory group as a family member. Again, it was really important that we involved people served, family members. We had some other large stakeholders, statewide stakeholders on the advisory group, and families. It was just really important that we had everybody's voice at the table. So welcome, Lydia. Thank you. And I apologize, I forgot you in my introduction. Edward, you're next on my screen. What was it like to be a part of this process?
It was tremendously humbling, to be honest. Just an amazing group of people coming together to change a paradigm, right? To say, look, you think that's a complex thing, and yes, as Kevin has lined out, it becomes complex to implement. But in reality, the concept is very, very simple. It's it's the golden rule: treat others, right, as you would want to be treated. Do unto others. And what that means is dignity and respect. And we created that environment together as a team, as the groundswell to creating this opportunity to change the world, if you will. I know Kevin's like, hey, hold on, let me get my pilot project before I start changing the world. But honestly, the changing of the world starts with one effort, one person, one conversation at a time. And that's really what PAVE set out to do.
Thank you so much. Elizabeth, you're next on my screen. Tell us a little bit about how it was for you to be involved in this process.
Okay, can I just say one thing that I heard earlier?
Absolutely.
I love Dr. Brown from the UK.
We do too.
She said it like nobody else could say it. I am a person that has cerebral palsy, and I'm 50 years old. And don't get me wrong, the medical model was great for what it was back in the day, but when people were in institutions, they wanted to keep people with disabilities safe and secure. But one thing they forgot to say, people with disabilities deserved to have a life. And now we're in 2021, and when I heard about what PAVE was about, I knew I had to be part of this great process, because I knew that I live in my own apartment. I am in charge of my day-to-day schedule, and I just want to say, people with disabilities we didn't ask to be disabled first and foremost, but so a lot of us was born this way, but we should be able to have the life we want. It's not our workers who come in our homes every day should have the money that they deserve to really do this work on a quality level. We shouldn't have to be, we shouldn't have to fight so hard to have a good quality of life, because everybody deserves a good quality of life. If you believe in human rights, then the money should be there. And I just want to say I love Amy Weissling. I think she's awesome. And I just want to say that people, everybody is going to be disabled at some point in their life. If you live long, you're going to have some type of ailment. So this isn't just for people with DD and IDD. This is a wake-up call for everybody who's gonna get elderly. So come on board with PAVE and pass the bill, because it benefits all of us. Come on, California, be the role model we know you can be. Show other states that they need to pay workers what they're worth. Thank you.
Thank you, Elizabeth.
And Liz drops the mic.
Right?
Right?
Joe, she's a tough act to follow, but tell us a little bit about your experience in the PAVE advisory group.
Thanks, Mark. The thing I think most excited about it is I know probably some of my colleagues will get upset, but listen to the other point of view of the parents, what they are saying, what they want for their loved ones. And get another point of view. I can say all I want, and if the parents are speaking up for their son or daughter, they can always be welcome. But it's nice to hear the parents' point of view as I'm an advocate for all people, even with the parents. If parents are doing good things, I strongly support the parents. As I go to the Capitol quite a bit at the time, quite a bit, I try to listen to the parents what they were saying, and I can use them as an example. I mean, the good part about it, I'm in IOS, but my roommate's in support living, so we both bounce ideas with each other, what we think, and we can talk things through. So it's just helpful to see that we're all coming together, no matter what our background is, what we do, what we believe in, whatever. We all came together at least once a month and flush it out for 2 hours plus, and get some great answers, and sometimes not so great answers. But the good part about it, we work together and we accomplish things that people probably say it was impossible.
Joe, thank you so much. And
Uh-huh.
thank you for the comments about a family member, because next we have Lydia, who is a mom. Lydia, tell us a little bit about your experience with the PAVE advisory group.
Well, it was awesome being a part of the advisory group. And it brought me to full realization that, you know, my son's own experiences over the last 20 some years, I feel that I've been very fortunate, not only in the services he receives, but the people that are in his life. And he's adopted 3 DSPs as his brothers, you know. And I just wish, and I see in PAVE a possibility of others receiving like services, you know, where they make their own choices. I go to sleep when I want to, I get up when I want to, I eat what and when I want to. Hey, if I want to go to an AC/DC concert, I go. It was just a lot of awakening in that process, and training truly is key.
Thank you, Lydia. Thanks so much. You know, as Kevin said, as we worked through this project, things shifted for us a couple of times, and we had to realign, and as we worked with our different consultants, it brought us to a different point. And I know that the day or the meeting that we had where we introduced way of life, and whether folks maintained a way of life or changed a way of life, was, I think, one of the most active I saw our self-advocates in the meeting, because they drowned out everybody else. When we stopped to think about how in somebody's birth month, they have to pick 3 different objectives that they're going to work on for the next year, that may or may not been important that day or the next day. When we shifted to achieving access points to maintain a way of life or change of a way of life, I saw our self-advocates just come alive and be like, yes, this is what we've been asking for. So I'm gonna jump right to the self-advocates here and say, Liz, tell us a little bit what that moment was like for you, because you were one of the most vocal people in the room when we said way of life.
I knew from years ago, from me knowing you, Mark, for a long time, when I got into support living, yes, it was hard. Yes, I'm not gonna lie to people. When I first got into my first apartment, I didn't know how to go to the bank on my own or what to ask. I got in trouble for asking for a microwave because I wanted to purchase a microwave for my kitchen. And that's when I knew, okay, I need to be my own self-advocate. I need to make a change. And the change I made was to go to a new agency where I started from the beginning. And I told the staff there, if you build a team around me, I know I can train them on the things I want and deserve. And it took a while because I didn't trust a lot of people. But when I met you, Mark, for the very first time, you blew my mind. You asked me what was important to me, and that spoke volumes to me. Like, somebody really wants to know what I want. Wow. And that was a paradigm shift. And I just live my life helping other people with DD and IDD to find their voice. And together, Mark, you helped me through the years to really show me that I can do it. I can live on my own. I do have a right to make choices of, like that mother said a minute ago, what time I want to go to bed, when I want to wake up, if I want to go to a concert. It's having a real life choice, and that's what it's all about. And I love how the group came together. This was a powerful group. I love working with this group of people because we were all dedicated and we all came together for the same cause. And it's not nothing that people with disabilities can't do as long as they have the right people in their corner and helping and assisting them to have the life that they want. And I want this group to stay together, so we have to do more work together. PAVE can never die.
I may have asked you, Liz, what you want, but you have always been somebody who the providers rotated around you. You've demanded that as long as I've known you. So thank you.
Well, you and Sarah Burgett brought it out of me.
Sarah, yeah. Joe, when we hit that moment of talking more about a way of life, what was that like for you? Oops.
I guess the agency I'm with today, I'm still with them 10 years, almost 10 years later. When I decided to join the agency I'm with today, and I went up to Jackie, we were in meetings together. I said, Jackie, I was recovering from my stroke, and I was in a meeting with Jackie, and I knew Jackie beforehand. I said, they were thinking about moving me into a group home, and Jackie said, why don't you try support living? And I said, well, I'm fine with it, but we have to convince my aunt. The big thing is, if my aunt accepts it, I will accept it. So someone new at this, And so I guess we convinced my aunt that I would, as I got out, we call it the old folks home. When we're coming from my stroke, almost 10 years later. And so me to a young man who has, she told me about the room I may have. We talked this and that, and he has one problem. He's a Giants fan, but that's fine. But right now, we are still roommates. 10 years later, we are still roommates. He's in support living. I'm in RS living situation. He gets 24/7, but if he needs 24/7 to have a quiet life, I'm fine with it. I get about 20 hours a month. So, and we work very well together. And it's good that seeing that, I'm not going to say the light at the end of the tunnel, but I feel that that's going, I see a lot of people moving forward with this. Other people can do it. I mean,
Thank you, Joe.
yes.
Put this in the refrigerator.
Joe, your microphone's cutting out a little bit on us.
We're both giving each other some wisdom and encouragement almost every day. Something we talk, I learn from him, he learns from me. So I can share with my friends or peers and give them confidence that they can do it. If I can do it, or if he can do it, so can you. Maybe a little slower, but let's find a way and the tools to be successful.
One of the things that Joe was always great about in the meetings was, how do I talk to my peers about this, you know, and I know that's what he does in his everyday. I saw some great photos of him assisting some of his peers to vote. So he's just such a champion for, and is still such a champion for getting the PAVE concepts out to his peers. So thank you, Joe. Lydia, when that way of life moment happens for you, how did that, you know, as a mom who's navigated the system for so many years, when we reached that moment of way of life, how did that hit you? Besides AC/DC concerts.
No, but so my experience has been so different. I mean, in the beginning, when we went to STEP, there were hiccups. Olaf came out of a state hospital, so there were some hiccups, and part of it was his continuing issues, but everything has settled down. I no longer worry about anything. I know he'll be okay if I suddenly disappeared. Sure, there'll be some time for mourning, but I know he'll be okay.
Nice.
You know, and he's surrounded by people who truly care about him.
I know that the agency that you're with is one of the 500 people in the United States that Dr. Julie Beadle-Brown talked about doing training with. So they're actually doing the some of the amazing work that's coming out of Dr. Julie Beadle-Brown and the Kent University. So you're with the right people, I think. And now I'm going to put my providers on the spot. You know, this was scary, I think, from a provider's perspective. When we hit that way of life moment, what was it like for you, Kim?
Exciting, because Elizabeth and Joe took over the meeting and everyone was talking, and it was like, yeah, shut up, let them talk and let them lead us, because that's really what it's about. How exciting it is to be a part of something innovative. And I think we all go into this with good intentions. We want to make a difference. but we don't always know if what we're doing is really effective. And so having this new model, just to really look at the person's way, I'm not even a recipient of those IPP meetings where I'm, the center of attention and everybody's telling me what I need to fix. And so I can't even imagine being in somebody's shoes to do that. And so this is putting them in the center, not the center. To me, like they're leading, they really are leading. And we talk about person-centered all the time, but this is like person-led. I'm leading, this is what I want. Elizabeth is like the epitome of the example of how we want everyone to treat us. Like, this is what I want, and I'm not gonna take note. This is how I want my life. And I'm just excited to be a part of something that can just change our whole system, our service delivery system.
Thank you, Kim. Edward, tell us about what your feelings were about that shift to thinking about it as a way of life and maintaining a way of life and achieving a certain lifestyle.
It was relieving. It was exhilarating. I've been fighting for that concept, when most of the reactions are, well, that doesn't fit into this box, or that doesn't fit into that box. And I'm like, I'm not trying to put people in boxes. I'm trying to have people have lives that they want to have. American author Brennan Manning put it, like, I think really, really well, right? In every encounter, you're either draining life or you're giving life, but there are no neutral exchanges. And if the provider is the center, or DDS, or the regional center of all that, the institutions are the center, then we're draining, right? We're not adding life to that person's walk, their journey. And the shift that PAVE is, and the vision it has, which is, it's a privilege. We have the privilege of walking alongside somebody and to make a living, if you will, doing that kind of work. Obviously I can't add to Liz's, pay them what they're worth, because that's, again, what I've been fighting with. And so this way of looking, I don't even think it's like a model. It's just like, stop making models and let's start talking about life. And if we get the chance to do that, then, we've solved a great deal of the issues, because we've now really stepped into the world of what does equity and inclusion and dignity look like, because we're not saying, well, you need this special thing and we have this special It's like, what do you want your life to look like, Liz? What do you want your life to look like, Joe? Let's get about it.
Nice.
Can I just say something? I gotta just thank the two of them for what they said. It's true that it used to be all about, well, we gotta get this person in this service, and we gotta get that person over there in that service, but nobody stopped to think to ask the person who's they were trying to fit in the nice little box, what it was that you want to do. It was always, we know what is best for you. So you go to this day program and stay from 8 to 3, and you just sit there being miserable. And that's what they used to call having the behavior, because you wasn't participating the way they thought you should. Now, I hope when this bill becomes a reality, because it is going to go forward, right, States? Yeah, I hope people will really wake up and see and people with disabilities. I have real life, and real life comes with real choices, just like every one of us on this panel. And for the mom that said her son is gonna be okay if she disappears, the way he's gonna be okay, because you raised him to be okay. You believed in him to be okay. So hell yeah, he's gonna be okay, because you instilled in him that he could do whatever he put his mind to. So it goes back to you. You did one hell of a job raising a young man. So you ought to be proud of yourself for doing a great job. And if I had a mother like you, I would give you all the kudos in the world, because you deserve it. That's why he's gonna be okay.
Thank you, Elizabeth. Folks, this was just a sampling of the amazing people that we had on our advisory committee. I see some other people that were on the committee also still in the room. Eric Campa, Carlos Alvida, they were invaluable in our work. We have reached our 2 o'clock mark. And I know there are questions, and a lot of our attendees might have questions. This was just our announcement. We will have opportunities for another forum where folks can ask questions. I can always be emailed with questions. I'll be happy to answer those questions. But I just want to thank every single one of our speakers today for this amazing program to really launch AB 813. We're going to have lots of work ahead of us to move this forward, but I see a lot of dedicated people that have been by our side all along, and we'll be enlisting everyone's support to get this going. So thank you to everybody so much, and we wish everyone a great weekend, and thanks for joining us today. Bye-bye, everybody.
Bye-bye.
Thank you.